Personal Care Management, PCM for short, is a special free health benefit offered by your employer through MedCost. It's easy to enroll and simple to follow. A registered nurse will become your personal health coach, and every month or so, the two of you will set up a convenient time for a short phone call to help you learn to take care of yourself and feel your best.
They work around your schedule. If you are working, they'll wait to call you after you get home from work. They'll call you any time of the evening time, or if you work second shift, they'll call you during the daytime after you are getting up and getting ready to go to work.
You know, if all I've got is 5 minutes, then that's what we spend is 5 minutes. But we set our goals and we talk about where I've come from and where I am. Who cannot take 5 minutes for themselves or 15 minutes for themselves? That 5 minutes, 15 minutes is going to be more well spent than you drinking the second cup of coffee or you sitting down catching 15 minutes of your favorite soap opera.
Ronnie and Kathy are just two PCM members you'll meet during the next few minutes. They all volunteered to tell their stories because they feel better physically and mentally. And it's thanks in part to the time they spend on the phone talking about their own specific health concerns in a completely private environment with their own personal PCM nurse.
Initially, I felt a little uncomfortable because I didn't know how the information would be used. I wasn't sure exactly, and I didn't really feel like I had a lot of pressing issues of concern to talk about. But it didn't take long at all because of her personality and her belief in the program and her explanation helping me to understand what it was about.
And a lot of times, I know one of the concerns we have with clients in the program when we first outreach them is the big brother fear. Somebody else knows my information. How did you find out that I had high blood pressure? And once we sort of abate those fears and let them know that it's a confidential program, we talk with them about that we don't let anyone else see their information. It is strictly confidential, and we work with them one-on-one so that they're only working with that particular coach that they're engaged with in the program.
Coach is a good way to describe your PCM nurse because there's a lot of support, education, and encouragement going on in areas like diet, exercise, medication, even stress. But a PCM nurse never gives orders or pushes people where they don't want to go.
She was aware of my weight when I started the program. She was aware of my cholesterol issues, my back issues, other type of issues. But she never dictated that you need to do this, you ought to do this, but she was suggestive that you might try this. So I felt like she was always helpful and suggestive, but never dictatorial.
We're there to help them. We're there as a personal trainer in a way, as a personal nurse coach. That's basically what we are for them. So the nurse part comes in that we have some medical knowledge and we can help them with that. And the coaching part comes in just being there to help them and remind them that yes, you can do that. And if it's not working the way we're doing it now, let's find a different way that will work for you.
And that's important because this is personal care management. Your PCM nurse is your partner and wants you to succeed.
Even if I'd had a month that wasn't the most perfect, she would find something that I'd done right and say, well, look what you've done. You can do a little better next time maybe, but look what you've done already. You met your goal. It was very encouraging to me to be able to know that I had done something right so that I would try a little harder the next time and maybe do 2 things right instead of 1.
And speaking of doing things right, PCM nurses support your doctor's care to make sure you're aware of all the health resources available.
When I went to the doctor, oftentimes I felt rushed and perhaps squeezed into a 15-minute or less slot. With a nurse coach, I felt like I had more time to relax, to explore my options, to talk about what might be going on, to connect the dots. Whereas in the doctor's office, I just felt like I needed to move on. It was very diagnostic, whereas the PCM program was also with feeling and caring and that more personalized touch that doctors just don't have the time to give you.
We try to enable the patients to become self-advocates with their physician. We try not to intervene with the physicians on their behalf because that's really their job. But what we do is try to work with them and say, these are some of the questions you might ask your physician if you're concerned about this. Be sure to write your questions down. Make sure you know that you have a right to get answers to your questions before you leave. So we help them with that. And as far as the on-site programs that the employers offer, we encourage them to participate in them, and in fact we make them aware of what's available. Sometimes they're not even aware.
Awareness is key to personal care management, because once people begin paying attention to their health, talking with their PCM nurse, and learning what they can do for themselves, they can begin making positive changes.
Being responsible for your own health care is really what we are about. It's making choices, it's making good choices, it's making informed choices. And that to me is what PCM, it undergirded everything else that I was doing to take care of me.
So I would tell anybody that might be on the fence about deciding whether or not to participate in something like this, there's opportunity to learn a whole lot more about your body and what's going on with it.
I feel great about it. They really helped me. I couldn't have did without MedCost and the PCM program, and I appreciate it every day that they was there for me when I needed them.
Well, what's it going to hurt to try? There's no way it can be negative because you're not losing anything. A few minutes a month, that's it. And the benefits are going to be so tremendous if you let it do what it's supposed to do.
For all those people out there that say, I've got a doctor involved and I've got this involved and I've got that involved, this is a step in the right direction to add one more set of eyes, one more set of opinions on what you're going through to make sure that everything out there is being done for you.
And that's what personal care management is really all about. You. And helping you to take care of yourself. If you're invited to participate in the program, think about it. It's a program that matters because it's a program that works.